Joined in the studio now live by our doc on call, Ryan Stanton. Now, a couple of weeks ago, Dr. Stanton was invited to the White House, not as a Republican or a Democrat or an independent, but one of the leading physicians in this country to give input on health care in this country. And of course, that is the driving force of today in the news with the Vice President being here. And when you went to the White House, what did you tell them?
Well, what we told them was exactly what healthcare professionals from around the country are saying, is that we need to make sure that no matter where this bill comes from, there's definitely improvements that need to be made. We need to make adjustments. Honestly, healthcare right now is a slow-burning tire fire. We've got to get this thing under control. And what we're talking about is getting coverage for people, legitimate coverage. And that's what we're seeing now, is a lot of coverage versus no coverage. But what we're talking about is real coverage. Does this cover you in case you need to go to the emergency room, in case you need to have something done? So making sure that we have access to care, so primary care, bolstering that system, which hasn't been expanded in decades, having quality access to care in terms of having real coverage from your insurance companies, which are right now refusing care to patients and providers alike, and just to make sure that when they think about this process of adjusting and changing, I don't know what they're going to call it in terms of health care, replacing this current system, is making sure that the patient and provider relationship is right there at the middle of that decision.
Because too often we now hear that they say, how can you pay versus how can we help? And again, this is at the core of all of this. Yes, we know that healthcare reform in this country right now is being driven politically, but we wanted to bring Dr. Stanton on to talk about healthcare coverage, your coverage, how much you have to pay. Are you paying more for less? That's one of the complaints. So we wanted to find out, not from the politicians, but from the medical community, what physicians and healthcare professionals want out of this repeal and replace that we expect from Obamacare.
And we're seeing less and less, and that's the biggest issue that we're seeing, is that we are getting less for our dollars, and it's making it difficult for patients and the providers involved. And making sure that when we do this replacement, this repeal and place, something's going to happen, is making sure that our patients have the care that they need when they need it, because honestly, it's not just patients. I'm a physician when I'm at the hospital, but I'm also patients when I go to my primary care physician, when I have to go to the emergency room, when we're taking care of my children and my wife and folks like that. We are just as ingrained in this system as everybody else. And so we want to make sure it works. And so instead of this politics, which is right now making it very difficult because both sides are taking our eye off the ball with the dramatics and everything that's going to happen if it stays this way or we change it, we're taking, it's a distraction. It's that three-card money that's taking our eye off the ball and of what's really there, and it's health care for Americans, and we need to make sure that it's there and that we're taking care of it and that I can be a physician for people when they need it.
The Vice President today during his visit to Lexington said that the Obamacare will be repealed and replaced by the end of the summer. Time will tell if that happens sooner rather than later in many people's eyes, but from the healthcare community, is it sooner rather than later as far as any type of changes?
Well, I think there is going to be significant change. If they're calling them to stay into the Senate for the next couple of weeks, I think they expect something to happen. Because what looks worse is if they stay in session longer and nothing happens. But I think all of us in healthcare are a little bit nervous because we don't know really what's going to happen. I think we're on pins and needles seeing what this new law they're going to put forward possibly tomorrow, and then what we can expect in terms of what it really means for healthcare and our patients.
Dr. Stanton, thank you for that insight from the medical side of things, not political. We'll be right back.